the city, we continue to urge individuals that live in Baltimore to get vaccinated and to encourage their families and friends to do so. As of today, 66.1% of residents have received a first or single dose of vaccine, and 59% of residents are fully vaccinated. We know that vaccination remains the most effective way to prevent transmission of COVID-19 and to limit hospitalizations and death. Vaccine is the way to prevent the spread of this virus and to prevent folks from getting severely sick or dying. The severity of this pandemic has not diminished, and it is still more important than ever to continue to wear your mask and get vaccinated to protect yourselves and those around you. As we gear up for implementation of the new vaccination policy for city employees on October 18th, we are doing everything we can to ensure that our employees have ample opportunities to get vaccinated. Yesterday, we hosted a vaccination clinic for city employees and their households because we want their families to be safe from this virus as well. I want to thank the Baltimore City Police Department and the Health Department for their collaboration on this effort. This clinic was the first of many that we will host in the upcoming weeks. Members of the public who have not yet been vaccinated are encouraged to visit covax.baltimorecity.gov. That's COVAX.baltimorecity.gov or call 443-984-8650 to schedule an appointment. Again, that's 443-984-8650. Do your part to help end this pandemic for good. Get vaccinated. Get your questions about the vaccine answered and get vaccinated so that we can save lives. I will now turn it over to Dr. D for our current metrics. Dr. D?
Good morning, and thank you, Mayor Scott, for your continued leadership. I'd like to begin by reviewing our COVID-19 data. As of yesterday, Baltimore City is averaging about 109 new cases per day. This is an increase of 30.3% from 2 weeks ago. Our average test positivity is 2.3%, a decrease of 4.9% from 2 weeks ago. We have seen a 7-day average of 134 hospitalizations in these past 2 weeks, with our acute care units operating at 92% capacity and our intensive care units at 89% capacity. To date, 58,980 Baltimore City residents have tested positive for COVID-19, and 1,183 residents have lost their lives due to the disease. As a reminder, the majority of COVID-19 cases nationally and locally are now Delta variant cases, a mutation of the original virus that causes COVID-19, which is almost twice as transmissible. The Baltimore City Health Department and our clinical partners continue to provide vaccines for our residents, meeting individuals and families where they are with mobile vaccination clinics in areas of low vaccination coverage across the city. We continue to show steady progress in our vaccination rates, and now 66.1% of all eligible residents aged 12 and up have received their first or single dose of vaccine, while 59.1% of all eligible residents 12 and up are fully vaccinated. The prevalence of the highly transmissible Delta variant prompted Baltimore City to reinstate its indoor mask mandate on August 9th. We appreciate all those residents and businesses who have abided by this rule to help limit the spread of disease. I'd like to take a moment and discuss what we as a city are looking for as we consider when to lift the indoor mask mandate. In order to ensure transparency, the Baltimore City Health Department has recently updated its coronavirus dashboard to highlight the key metrics used in decision-making around lifting the mask mandate. We base these decisions on a number of factors, including new case rates, deaths, test positivity, hospitalizations, the percentage of our population that is vaccinated, as well as the CDC's determination of our community transmission level. When we introduced the mask mandate in August, the CDC indicated that Baltimore City had substantial community transmission. Currently, the CDC has indicated that Baltimore City is experiencing high community transmission rates. Sustained decreases in these key metrics for at least 2 weeks is what we are evaluating when considering lifting the mask mandate. All of these figures can be conveniently found on our coronavirus dashboard, specifically under the key metrics page at coronavirus.baltimorecity.gov. In September, the CDC made announcements regarding both additional doses for immunocompromised individuals as well as booster doses for individuals in certain categories. We've received some questions regarding eligibility in both of these circumstances, and I'd like to take a moment to further elaborate on the differences. Currently, the CDC recommends moderately to severely immunocompromised people consider receiving an additional or third dose of either Pfizer or Moderna COVID-19 vaccine at least 28 days after the completion of the initial 2-dose mRNA COVID-19 vaccine series. We encourage residents who may be moderately to severely immunocompromised to speak with their healthcare provider about this need to receive an additional dose. More recently, on September 24th, the CDC recommended certain groups receive a booster shot of Pfizer's COVID-19 vaccine at least 6 months after the completion of their Pfizer vaccine primary series. The CDC specifically recommends adults 65 years and older and residents in long-term care settings should receive a booster. People aged 50 to 64 with certain underlying medical conditions should also receive a booster. People aged 18 to 49 who are at high risk for severe COVID-19 due to certain underlying medical conditions may receive a booster, and people aged 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of their occupation may also receive a booster. Occupations considered to be high risk for COVID-19 exposure and transmission include first responders, such as healthcare workers, firefighters, police, and congregate care staff. It also includes education staff, food and agricultural workers, manufacturing workers, corrections workers, U.S. Postal Service workers, public transit workers, and grocery store workers. People in the recommended groups who receive the Moderna or J&J vaccine will likely need a booster shot, and more data on the effectiveness and safety of these boosters are expected to come in the next few weeks. However, we ask at this time that residents who receive the Moderna or Johnson & Johnson vaccine don't mix and match with the Pfizer booster. In other words, these booster recommendations are only applicable at this point if you received a Pfizer vaccine in your original series. Many of our providers are equipped to provide booster doses. However, I would encourage residents to call our COVAX call center at 443-984-8650, Monday through Friday, from 8:30 a.m. to 6:30 p.m., and Saturdays from 9 a.m. to 1 p.m. to confirm that a particular vaccine is available to be provided at the clinic that you're planning to attend. Your physical or digital proof of previous vaccinations will be necessary to receive the booster dose of the Pfizer vaccine. Additionally, the Baltimore City Health Department provides updates to its weekly vaccination schedule at baltimorecity.gov/BeMoreVax. Individuals without access to the internet can call our call center, 443-984-8650, to chat with a representative and understand where they can go to receive a vaccine. Likewise, if someone has trouble leaving their home, they can register with our Vax at Home program to have vaccines brought to them and their caregivers, either by calling that same number at our call center or registering at covax.baltimorecity.gov. Thank you.
Thank you, Dr. D, and thank you for your continued excellent leadership for Baltimore throughout COVID-19. Before we take questions, I want to mention our behavioral health implementation plan, the first draft of which is now available for public comment until October the 30th. You can read the plan online at mayor.baltimorecity.gov under the Behavioral Health and Consent Decree tab. This plan is a huge part of fulfilling the requirements of the consent decree for our police department and demonstrates a commitment to providing the best services for Baltimore City residents. Status quo solutions for policing, public safety, and addressing the needs of those experiencing behavioral health crises are not providing the best outcomes for our residents. This implementation plan will work to fix this issue, move us forward, and address the recommendations identified in the Public Behavioral Health Systems Gap Analysis Report. And with that, we'll take a few questions. Sir?
For Deputy Sullivan, if you could you talk about the efforts police brass have made to get the rank and file vaccinated and what kind of feedback you're getting from some staff and officers on that?
We've worked from the beginning of this pandemic to get our officers not only vaccinated, but the equipment that they need to keep themselves safe. So we've provided vaccines at the police department. We've also provided them the ability to get vaccines while they're actually at work. So we've done a very good job, and I don't have the percentage, but we can get those percentage to you after this event.
And just to add, I think this has really been a true partnership with the department and also with the leadership of the union, who has been very supportive of making sure that their members are vaccinated as well. Ma'am?
Mayor Scott, I want to ask about the Militant church rally. Do you feel that the city is violating the freedom of speech rights of this group that wants to hold this at the Mecca Pavilion next month?
As you know, this is in court. This is something that you should discuss only with the law department, but I will say this, everything that we're doing is in the best interest of Baltimore City residents.
I have a question for police. We've been hearing a lot of concern from residents across the city about open-air drug dealing. We heard from Commissioner Harrison on it this week, as well as a councilman. Can you talk about what's being done within the department to make sure officers are being properly trained to make arrests in these cases?
I'll start. Let me be very clear. The police department will and will continue to deal with folks who are illegally selling drugs. And that's what they do themselves in patrol through our detectives. I think that you guys have covered events that we've had with our federal partners and our state partners about major drug busts. They will continue to do that work each and every day. The training has always been there. It's also about making sure that we're working with the community. This is why we're working on community policing plans to make sure that every community gets the service that they need. But the Baltimore Police Department will continue to hold folks who are operating these illegal businesses, which we know contribute to violence, accountable. Mr. Deputy?
No, and I think the commissioner spoke to this on Wednesday. We're focused on this, and if you watch what we put out on a regular basis through social media, our officers are out there working very hard to take anybody that is out there distributing drugs and charge them. We do it on a regular basis, and that information is readily available.
What would you say to residents who say that they're continually witnessing this? What should they do?
Well, we know first they should report that to 911, and then they should work alongside their local district and their local officers to address the issue, but also understanding that we have to also build cases too. What residents don't want is what we've had happen in the past, where the police department goes out and make a bunch of penny ante arrests and the person is back out. This is about removing people from neighborhoods. Thank you. Lisa?
For the mayor or Dr. Jaraza. I was not too long ago in one of the public housing communities in East Baltimore, and a number of ministers were down there trying to convince people about getting the vaccine. And this is a group of people who just said, we had every reason, you're going to get sick from it. I'm not putting that in my body. These are people it just seems like you cannot shake. So how do you get to those people to, make sure that they're vaccinated? And sometimes these are just folks who, they're not necessarily working. They're out there. How do you get to them? Because they're already vulnerable.
Yeah, I think in the health department and Dr. D and the city really have come together, do a great job of collaborating on that. This is why we go into those places. You know, I've had the opportunity to see them in action. Actually, last Friday, I was in Patterson Park with the Youth Council of Rec and Parks, who also had youth COVID ambassadors there, convincing their counterparts to get the vaccine. This is what the health department does each and every day. This is why we have our credible messengers going wherever we can. But Lisa, I also think it's important for us to, as residents, right? Especially as for me, as a young black man, I take it upon myself to have conversations with other young black men that Dr. D can't even have. We have to have those culturally hard, but those culturally sensitive and necessary conversations with folks, letting people know the difference, that there's a lot of misinformation out there, that this is not Tuskegee. And what happened in Tuskegee is the opposite of what they're saying. They actually didn't treat those people. We want you to get treated. We have to have those tough conversations. We all know, especially in Baltimore, the history, especially when you're talking about black communities in the medical industry, but we have to understand this. We are dying more than anywhere else. That's the reality of what's happening in our city, and those tough conversations will continue to be had. We are seeing the numbers and seeing things improve, but we know we have a long way to go. Dr. D?
No, I think Mayor Scott touched on this, right? So months ago, we started our Value Ambassadors program with a specific focus on communities that we know would be harder to reach, communities that we knew were at higher risk for COVID-19. So we've hired folks who work in the community, who live in the community, alongside the people that they're educating, that they're trying to influence. And so many of those people go knocking door to door to have these hard conversations. Likewise, as he mentioned, we've partnered with the Mayor's Office of Neighborhoods, who helps us canvass ahead of vaccination events. What we know now is, as you mentioned, a lot of the folks who aren't vaccinated now, we really have to work to dispel the misinformation and make sure that they have the information they need to make the right decision, as well as ensure that there's access. So we really have positioned, as you can see by our map online, our vaccination sites in the areas of lowest coverage. But the education is going to be ongoing, and our team is doing it every day.
Thank you.
Ma'am?
Good morning.
Good morning.
I have a question about legislation that's due to appear on Monday's council meeting docket, although it's not finalized yet. Councilwoman Odette Ramos introduced 2 bills related to the tax sale. One would establish a monthly payment plan for property tax. The other would require more public reports from the city on problems with the Militant system. Should those pass, and they're slated to, do you plan on signing them?
Well, what I always say, Emily, is that we're going to let the process work out. This is the first that I myself am hearing about them. We'll be talking with the councilwoman, I'm sure. I know I'll see her later on this evening. And as they go through the process, we will work to see what's best for Baltimore's residents. We have a great working relationship with the councilwoman. As you saw her here with me last week talking about our tax sale work group and the things that we're doing collectively. And we know that I'm a big proponent of transparency, and the councilwoman is as well. And we look forward to working with this issue with her.
Thank you.
Yes, ma'am.
Mayor Scott, the plastic bag ban goes into effect today. I'm curious what challenges you anticipate in the weeks and months to come, and are there still events planned to get reusable bags distributed in certain areas as well?
Yes, we're going to continue to get reusable bags out to folks. I know this is a big cultural shift for Baltimore, but I want our residents to know that it can be done. Our sister city in D.C. did it some many moons ago, and the Anacostia River is a lot cleaner for it. We know that in Baltimore, I grew up hearing from my grandmother about how they used to carry their own bags to the grocery store. We know that places like Aldi and Save-A-Lot that are in a lot of neighborhoods already were charging for bags. But I also know that culturally, as I do myself, I probably have 1.5 years of stored plastic bags underneath my kitchen sink. So as we work through this and get everyone accustomed to that, we want them to use that while we're providing those bags, because this is about making our city cleaner for not just now, but for the folks coming behind us. Thank you, everybody.